uh, what we're looking at is, a topic today, and how we can, handle the COVID-19 and key updates. So let's look at the next slide. So we're going to go through uh, these different, try to cover these. It's a broad area, but we'll try to cover the Delta variant and what's the significance and how to
Yeah.
stay safe, and what to do if you get infected, and what are the new variants like mu variant, NU
Sure.
variant. So we'll go over that. So let's go
So,
back to, let me put one slide up, and then we'll get your take on what is Delta variant, Sandeep.
so, we all know at this point that COVID-19 is the disease caused by the SARS coronavirus 2. SARS stands for, uh, what is that? Respiratory adult syndrome, severe respiratory adult syndrome, coronavirus 2. This is an RNA virus. So built into that is when RNA viruses replicate and multiply once they infect the cells. In that multiplication process, the errors creep in because it's not a very high fidelity process of multiplication. So that is normal, that is natural, that is how it happens. But as a consequence of this error-filled process, a lot of mutations are generated. And the more the virus replicates, the more these mutations happen. Some of them persist and accumulate, and branches in the lineage develop, and a variant emerges that can survive, that can transmit itself, maybe cause disease to a large extent or a lesser extent, and then is also affected in the sense that it can evade the immunity that is generated by an earlier infection or the vaccines that you give. It can evade even therapeutic maneuvers that we have come to use. So that is what happens. One of the first ones variant that happened was detected in UK. It was alpha. Then the beta variant was talked about. That came out of South Africa. Then the Delta variant is now talked about. It originated in India. We stopped naming them or associating them with countries of origin or places of origin for obvious reasons, so that they don't get linked to a certain country or race or ethnicity. And then
I
the
think that was a
nomenclature
smart
changed.
move because, the variants can happen, as you know, any place. And I think the key piece, as we're going to get deeper into discussion, is to have more people throughout the world, not just United States, vaccinated, so we have less people who are available for virus to mutate. So I think that's the key point. Where they originate from is not of any interest anymore, because we are a tight knit world now. One flight away for anyone infected, despite you getting them tested. They may be in the prodrome, they may be already vaccinated, and maybe still carrying it and may not have the full load of the disease. So I think the key piece, uh, as you rightly said, we should not look at the origin, but look at helping everyone get vaccinated quicker the better, because then hopefully this become a chapter in the history of vaccines like measles, mumps, rubella, polio, host of others, where the effective vaccines have tamed it down, like smallpox, chickenpox. All those are sad chapters, but they are behind us. And if everyone take vaccine, and that could be another chapter behind us.
Definitely.
Mm.
And so that is how Delta variant came to be. And like you said, we live in a very small village, a global village, so to say, and you're a hop and skip away from any part of the world. So these viruses have ample opportunity to spread very quickly. Delta variant, because of the mutations that it has acquired, has also acquired the property of being more transmissible. So if the alpha variant or the original wild type coronavirus could go from one person to maybe two people, that is called the reproductive rate. Delta can probably infect 4 or 5 people after it infects one person. So, the rate of progression of the illness or infection in the community can very rapidly scale up, and suddenly, from one household to the entire neighborhood to a city can get infected in a matter of days, which is what happened. So that is the significance of the Delta variant. There are a couple of studies that also point towards that not only is it more transmissible, it also can cause more severe disease. That is not quite settled, but at least there are two studies, I think one from Canada, one from Scotland, that the CDC website lists, that points towards this fact that it does cause more severe disease.